This is CGTN, China Global Television Network.
Hello and welcome to this Razor COVID-19 special. I'm Shini Somara. Many of us hope that once we emerge from lockdown, life would return to normal, but that may not be the case. Emma Keeling spoke to immuno-biologist Professor Akiko Iwasaki from the Yale School of Medicine. Her research has shown that the virus is something that we may just have to get used to. In the meantime, she's working on a simple, non-invasive saliva test to detect it.
Currently, most of the places are using nasopharyngeal swabs, which are these long swabs that people have to insert, deep into the nose and scrape the, back of the nose to get some viral RNA. And that is extracted in the laboratory to test for COVID-19 RNA. However, that is not only invasive, it requires personal protection equipment by the healthcare workers that are collecting the swabs, as well as a lot of other steps that are involved. And we thought that instead of relying on swabs that are actually also in shortage, right? So many places are unable to test for COVID-19 just because we don't have enough swabs. Would there be any other specimen that we can use to test for a person's COVID-19 status? And so we've been testing oral pharyngeal swabs, which are what you kind of put in the mouth, as well as nasopharyngeal swabs, as well as saliva, to compare which of these specimens can give us a most reliable and most sensitive detection for COVID-19. And it turns out that saliva is a wonderful specimen for this. Not only is it very easy to collect, it's not invasive, you can even have the patient collect it themselves. So self-collection is a possibility for saliva. And it's also very sensitive. It's much more sensitive than the nasopharyngeal swab, and that makes it more reliable.
Now, despite all of that's going on, you've somehow found time to publish a new research paper focusing on the seasonality of respiratory viral infections like SARS and COVID-2 as well. So what more can you tell us about that? Will the number of cases drop once the weather starts to warm up?
So in that study, what we found was that the respiratory viruses like COVID-19 is prevalent in the wintertime. And we tried to dig into the mechanism. Why are these respiratory viruses prevalent in the wintertime? And the answers we found were, there are multiple reasons, but a key reason is the humidity. So the relative humidity of the air that we breathe in is a very important factor that controls viral transmission.
The key word here is relative. Viruses don't like humidity. The same amount of water vapour has higher relative humidity in cool air than in warm air. So when we bring cool outside air inside to the warmth, the relative humidity drops.
And in that setting, the relative humidity of the indoor condition becomes very low, like 20 to 30% relative humidity, which is very dry air. And that's the type of humidity in which viruses like SARS-CoV-2 can thrive. It can remain stable and it can travel longer distance and it can, infect others, as well as it impacts the host immune response. We found that respiratory tract immune response works best at humidity levels between 40 to 60%. So this means that in terms of both viral stability as well as our host immune response, winter months is actually, terrible conditions for both of these. And that is what allows these respiratory viruses to succeed in transmitting between people during the winter months.
For all the reasons that you just discussed, we come out of lockdown, we're going into autumn and winter. Are we going to see another spike?
I'm afraid that without any intervention, there will be spikes. And the cold and dry air is not going to help with flattening the curve. So what we need as society right now is to find, obviously vaccines would be really, really great for protecting the entire population against this virus so that there are no second or third spikes. The other things that we can have is, therapeutics or prophylactic drugs, that if there are, safe and effective drugs that can treat or prevent this infection, that would also allow us to prevent the second spike from happening. But based on what we know about relative humidity and what it does to viral transmission, I would expect that upcoming winter is going to be another period that we really need to be cautious about. So, we may be able to come out very slowly, for example, staggered work schedule or social distancing measures still in place, and then slowly come back to, open the society. But we have to do it carefully, and we have to do it with a lot of testing. Because if we can have enough tests for everyone to screen for who's infectious, who's been exposed, who's no longer going to be infectious, there's a more intelligent way of opening up the society as opposed to just sort of randomly deciding to go back to normal.
So is COVID-19 here to stay? Is this something like the seasonal flu, the common cold? Do we expect to sort of go through this every single year?
COVID-19 is not really going anywhere at this point. And even in the summer months, we probably will continue to see spread because it's not only transmitted through the air, but it's also transmitted through direct contact and fomite transmission. So I don't see this virus really going away without any interventions. And it might ultimately become, annual, like seasonal virus infection, but we're not even close to that yet.
Another technique that will assist in allowing that intelligent opening up of society Professor Akiko referred to is contact tracing. That's where data systems and mobile technology keep track of whether we've come into contact with the virus and alert us if we need to isolate. Governments around the world have put either part or all of their population under strict lockdown measures in an attempt to stop the rapid spread of COVID-19. The goal is to reduce the number of daily cases to ensure it remains below the coping capacity of healthcare systems. This has been referred to as flattening the curve. But the concern is that if lockdown measures are eased, then a second peak and even later peaks could cripple healthcare systems into the near future. One strategy to maintain a reduction in daily cases without using mass lockdown measures is known as contact tracing. This involves identifying, tracking, and isolating individual cases of COVID-19 to suppress it from spreading throughout a population. It's usually a very labour-intensive process, but now big data and technology are allowing for new solutions. The first country to lift local lockdown measures and trial one of these new technology-led contact tracing solutions is China. Here, local governments are pairing with major tech companies such as Alipay and Tencent to create what they're calling a traffic light system. Data points around a user's activities, personal connections, and travel history provide a coloured health QR code. Red means you should be under supervised quarantine. Yellow indicates that you should self-quarantine for 14 days, and green means that you can travel freely. Your status is regularly checked whilst travelling throughout the country. If you come into contact with the virus, then your status will change and you will no longer be able to travel, forcing you to isolate. A similar contact tracing approach has been very successful in South Korea. After a different coronavirus outbreak called MERS hit the country in 2015, emergency legislation was created which allowed health officials to trace the footsteps of citizens who test positive for an infectious disease using CCTV, credit card records, and GPS data. When they received their first positive COVID-19 patient in January 2020, this legislation was brought to the fore again and used to identify everyone that had been in prolonged contact with the infected individual. They were all tested and then quarantined if necessary. The government also released anonymised smartphone alerts to inform the wider population of the infected person's previous movements. If tested positive, an infectious person can choose to self-isolate at home, but is required to download an app, which alerts an assigned health official if they leave their home during the quarantine period. This process has helped South Korea avoid national lockdown, but has raised privacy concerns that have forced other governments and institutions to look at alternative methods. Another country which has also avoided national lockdown by using widespread testing and very intensive traditional manual contact tracing is Singapore. To support these measures, the Ministry of Health released the app Trace Together. It's voluntary for people to download and has a strong focus on digital privacy measures, such as avoiding using location data. Instead, it works by using Bluetooth to identify other mobile phones within a 2 to 5 metre radius. As an individual goes about their day, the app logs the anonymised data for those who have been in close proximity. These are then stored in an encrypted log on the phone. If the individual wakes up the next day with a fever, this can be reported on the app, and then the Ministry of Health can request their log data, decrypt the information, de-anonymise it to reveal the phone numbers of those who have been in close contact, and then use to inform them to self-isolate. Using technology this way allows for a scalable contact tracing solution that is accurate, efficient, and instantaneous. For these reasons, many other governments and institutions, such as the NHS in the UK and MIT Media Lab in the US, are developing applications using similar Bluetooth-based approaches. One caveat, according to the researchers at the University of Oxford, is that effective digital herd protection, as it's known, requires 60% of the population to voluntarily download and use the app. That's a big ask. Contact tracing does have one major weakness: asymptomatic spreaders. These are individuals that carry the disease, pass it on to others, but don't have symptoms themselves and don't isolate. But how many asymptomatic carriers of COVID-19 are there? Well, it's difficult to calculate. One study focuses on the Diamond Princess cruise ship, which was hit by coronavirus and quarantined in Japanese waters on the 3rd of February, with 3,711 passengers and crew. 634 individuals ended up testing positive for COVID-19. 52% showed no symptoms at the time. Approximately 30% of those went on to show symptoms later, leaving 18% testing positive but never showing any signs of illness. Other studies in Japan and China suggest the figure could be as high as 30%. For these reasons, contact tracing must work alongside rigorous widespread testing and other social distancing measures to ensure lives are not put in any unnecessary risk when countries emerge from lockdown.
The world's currencies are more connected than ever before. The mechanisms that drive the economy are universal. Money moves markets. We explain these trends and show you how the cash in your pocket can have a wide-reaching effect. Because money makes the world go round. Global business.
Earlier in the year, Razor's Joe Colan met Professor Chris Toumazou. His company, DNANudge, has developed genetic testing cartridges that help people make healthy food choices based on their DNA profile. Since then, Professor Toumazou and his team have adapted their process to test for coronavirus.
DNANudge is the brainchild of Imperial University's Regis Engineering Professor Chris Toumazou.
We differ by about 0.1%, and it's that 0.1% that differentiates us from whether we got propensities to genetic diseases, whether or not we can metabolize various foods, whether or not we can metabolize drugs, etc., etc. Okay. This chip here has 96 wells. So effectively, we've taken propensities for things like type 2 diabetes, obesity, hypertension. These are these genetic errors. We then spread those across those wells. So once your DNA is then extracted from your saliva, your DNA is then spread over those wells. And once it's matched to a primer, we know that you've got that genetic propensity. If it doesn't match, you haven't got that propensity. So it's a process of matched and unmatched sequence, basically, on this particular chip. And that's all done in situ in an area as small as this. This replaces an entire laboratory, replaces white coats, pipettes, machines, 3 or 4 weeks of lab time, the cost, the speed, everything is done. And more importantly, privacy. The fact is that because your genetic sample, whether it's a cell or saliva, is actually within the device itself, once the test is done, this is thrown away.
So Chris, when I filmed with you earlier this year, you had just launched the DNANudge cartridges, which were designed to help people make better food choices. And since then, you've adapted the cartridges to a very different purpose related to COVID-19. What can you tell us about that?
Back in March, it was actually March that was the eureka moment. You know, we were sitting down in the lab and we started thinking, well, look, you know, all we have to do to this is basically change the primers on our chip, the bait, to bait that can detect effectively corona. That was the first step. And to change some of the mix in the cartridge to transcript from RNA to DNA. So once you've inserted the swab into the cartridge, we're able then to extract the virus, introduce it into our cartridge and do the initial testing. And that's when we went, wow, because it's almost binary. You've either got the virus or you don't. That's the beauty of it, see. Unlike the genetics that we were looking at, where we're looking at mutations in our DNA, in our sequence, here, we're just looking at, do you have the viral RNA or don't you?
And you can be asymptomatic and still have the virus.
Exactly, and it can be quite infectious. In fact, one of the clinical virologists at St. Mary's had a very, very small cough on the first day we tested this, and we asked him to go to his car and just test himself with a cartridge, which he did, and he was so positive. He would not have known. He was so positive. One of the strongest signals we'd ever seen. So he went home into isolation. But what we did is so imagine if he hadn't, and he could have spread it, obviously. We gave him 5 cartridges to go home with. So every day, for 7 days, he distributed a swabbing of 5 cartridges. So he stored 5 cartridges. So day 7, he came out and had another swab. And what we were able to do is measure through this, detect the virus on those 5, 6, 7 days. And we saw the regression of the virus until the 7th day, there was a very weak positive signal. So the virus actually stayed in the device for the number of days, and we could actually monitor. So that could be another important use, actually, the continuous monitoring. When people are in isolation and they want to come out of isolation, you could courier them the cartridges, they swab, and then we can measure the reduction.
That's astonishing. So it really is a lab in cartridge rapid test if you're able to see those results in an hour.
Exactly. I mean, the whole idea, has been to reduce the throughput. And as we know in the field today, PCR tests, the big testing is taking some 24 to 48 hours. And that's because there's this huge manual process. Once the swab is taken, it could be a nasal swab. I mean, here's a typical swab that's used in the field. A nasal swab that might go into the nasopharyngeal up in the nostrils or in the throat. This then has to go into viral transport media to keep the virus alive. Then it has to go to a laboratory, a very, very high quality, very well contained laboratory. From that, one extracts the RNA, and then that goes into a big PCR machine. And that machine not only does one individual's test, it tests for many individual targets. And then after that, the results get then processed, they then get recorded, and then it goes back to the hospital, then the patient. So that whole process could take 48 to 36 hours sometimes. And it's because of that sort of long-winded throughput. With this, we can do it instantly. I mean, the sample bit, the throughput has gone completely down because we'll take a swab, maybe a quick nasal swab, goes into the nostril. This then goes into the cartridge. Then a little button clip closes it up. Everything's then sealed, completely sealed. Once it's sealed, you've contained the virus. This then goes into our nudge box where the actual cartridge will fit into the box. You close the cartridge, you close the box, and within just over an hour, the results will come through on your phone. We will start deploying this within particular niche areas where the point of care aspects are really, really useful. Eventually, obviously we'd like to go to care homes and then move into sort of the community. But at the moment, the Department of Health are quite keen for us to still focus on those borderline cases in areas where staff might be, they might have a suspicion of the virus, but not quite there. Quick testing. Also mentioned maternity ward, surgery, A&E. Those are the areas that we're collaborating on now.
Studying the spread of the coronavirus, there's just one place to go. It's a website called NPOP2019.live. It's now being used by researchers, journalists, and even governments. And it was all created by 17-year-old Avi Schiffman in his Seattle bedroom because he wasn't happy with the information he was getting anywhere else.
So I started working on a website to just kind of automatically take those numbers and just make it, visually appealing and easy to use just on a phone or, a computer. If you want the numbers, it's all there in front of you. You can sort it, search, do whatever you want with it. But, it shouldn't have to be hard to find the information. With my website, it makes it really easy. It's just a simple dashboard you can look at. Let's say you wanted to check up on your entire family and each one of them lives around the world. You don't have to go to, 7 different government websites just to see your individual countries and stuff. Everything is just all in one place. So
yeah, I mean, it's a fantastically laid out website. I was going through it and it's just so simple to read. It's so clear and concise. What's the functionality behind it?
So the way it works is it uses a technology called web scraping. So, let's say Korea, for example, they have like a local government kind of website. You're able to like automatically take those numbers. So, they have like a table, might say like, one case here, two cases there. And you're basically able to download that and add it to a much larger data set, which is what I'm able to do. Then, automatically every couple minutes or so, gets those numbers and, continues adding that for all the different countries. That way, it continues to automatically update. So even while I'm sleeping, it's daytime in London or something like that. And, they're still using the website over there. So it works 24/7. And I think that's kind of cool.
How did you know back in December when you started this, it was going to grow?
I mean, when I started this website, I never expected it to be a global pandemic or anything like that. I mean, my generation has never had anything like this. And, there hasn't been just a giant world event like this big since, like, I don't know, World War II or something. I never expected the website to become this popular either. But, both of those things happened, just over time. And, it's been a great experience to learn how to manage such a high traffic website. But, there's just so much pressure to keep the website, constantly working 24/7, just because, if there's ever any hiccup, then, there's tons and tons of people right at their keyboards ready to send emails and emails and emails and all that kind of stuff. I mean, people will notify me from like all around the world. It's a lot of work and everything, but, I never expected it to become this big. But, since then, the website has continued to evolve. It's getting better and better over time. And, more and more people, actually genuinely use it every single day. So I think it's pretty cool.
Why did you have an interest in a medical application?
Sure. I mean, I was just, working on many projects at the same time, and this was just like another project I was working on as well. And, health analytics is, I guess, something interesting to me, I guess, because my mom is a doctor. But, I was just kind of using the technology that I knew how to use, and I was just kind of working on a website. And then, it became popular, and now, I guess I've been looking at health analytics for like 5 months straight. But yeah.
Is that your mum in the background? I can hear someone.
No, that's my little brother yelling. I can go make him stop, but.
I mean, your app is influencing government.
There's so many visitors from like all around the world. It's a big task to keep it maintained. I mean, every single day, there's a visitor from every single country on the entire planet. I mean, I get visitors from Greenland and the Congo, everywhere. It's very interesting to look at and just to see what people are doing, just on the website all this time. What's also interesting is you're able to kind of track the growth of the coronavirus and the website traffic. So let's say it spreads to like Germany, then I'll notice that there's a lot more traffic from Germany. So it's kind of interesting to watch it spread as the website spreads, I guess, as well.
You're also becoming an expert on how this virus is spreading.
I think it's really, interesting, I guess. I've been able to infer a lot of things based upon just staring at these numbers for so long. I mean, for example, a while ago, South Korea and Iran had pretty similar case counts, but Iran had like 10 times more deaths. And, it's not a different virus over there in Iran. So I think you're able to kind of infer interesting things based on these numbers, like are their hospitals overwhelmed, or what's their healthcare system like, or, what the people are genuinely doing, like are they mostly staying home? So, there's a lot of interesting things to look at from these numbers. I mean, I'm not a doctor or anything, but, plenty of people make their own predictions, based on just the raw data, I guess. Plenty of people make their own charts and all that kind of stuff. So
you're trying to limit people's anxiety and fears about the spread of the virus. How are you making sure that the data you're collecting is completely factual?
With a lot of the numbers and stuff, you can only trust them so much. I mean, when it's a lot harder to get accurate numbers from a lot like more authoritarian governments and stuff. So I can believe the numbers only as much as, the governments want me to believe. So yeah.
And there's a lot of junk on the web, a lot of bad.
Yeah, I wanted to make my website very minimalistic. It's very easy to use no matter like how old you are or anything like that. There's no big like political advertising or, all kinds of just nonsense. There's no misinformation. That was another thing that I noticed a lot when I was working on this website. So, I wanted to make the website, free of any biases or anything like that.
That's it for this edition of Razor. Keep yourself safe and we'll see you next week.